the asthmatic horse. We're here today to talk about equine asthma, what it is, what causes it, and how it can be treated. Without further ado, let's saddle up and get started. Before I get into what asthma is, I want to talk about the history of its name. Initially, it was called COPD, chronic obstructive pulmonary disease. In the year 2000, it was changed to recurrent airway obstruction to more accurately represent the nature of this condition. Some common names you might hear for it include heaves and more recently asthma. For the rest of this presentation, I'm going to refer to it as asthma since that's what my horse was diagnosed with and that's what the vet called it when she was diagnosed. Asthma is an inflammatory response of the airways that happens when lung cells produce histamines. The histamines are produced when something triggers them. So this inflammation can also cause secondary bacterial infection like pneumonia or other bacterial infections. And this can be very serious, and that is definitely something you need to have your vet out for. So some causes of asthma include allergies to dust, pollens, molds, other things like that. And there's also thought to be a genetic component to it as well. Scientists aren't exactly sure what it is, but they're still looking into that. Some symptoms that you will see with asthma include an elevated respiration rate. The average resting respiration rate for an adult horse is 8 to 16 breaths per minute. So if it's much higher than that, you might want to have your vet out, especially if it is coupled with labored breathing. Labored breathing is when the nostrils are flared and you might even see or be able to hear your horse breathing. So as you can see on the left here, the nostrils are very flared. They're sticking out and dilated so that as much oxygen as possible can get in with each breath. On the right is what normal nostrils should look like. These pictures are a great example of why chronic obstructive pulmonary disease was not an accurate name for this condition. Those are both pictures of my horse after she's been diagnosed with asthma. So it's more like asthma where it comes and goes, and there will be times when it's really bad and other times when it doesn't really affect her at all. So the way that you can take your horse's respiration rate is you can either watch their nostril or their flank area. If your horse is healthy and not having respiratory problems, watching their flank is going to be the best option because you won't be able to see their nostril going in and out very much. So you're going to watch either of those areas for 15 seconds and then multiply whatever number you get by 4. It's important that you take your horse's respiration rate either in the morning or evening when the sun is not at its peak, especially in the summer. The heat can cause the respiration rate to go up even in a normal horse. It's also really good to take your horse's respiration rate regularly, like every month, even if your horse does not have any issues. This establishes a baseline of what your horse's normal respiration rate is and will help you to know if something is out of place in the future. With the labored breathing, another thing that can happen is a heave line will form, and that's a muscular band right here on the horse. This develops when the abdominal muscles have to help the respiratory system pushing air out of the lungs. The respiratory system is usually able to handle it, but in an asthmatic horse, the inflammation causes it to be harder to push air through the lungs. Also, you can see congestion or nasal discharge in your asthmatic horse. And the nasal discharge will usually be just clear or white, but if it is colored like green or yellow or another color, it's really crucial that you have your vet out right away. That could be a sign of the secondary bacterial infection. There can also be a cough that comes with equine asthma, and this might be exercise-induced or at rest. And so that can limit what your asthmatic horse is able to do in terms of exercise because they might start coughing as exercise is increased. Some other symptoms that you can see is an eye discharge. And as you can see in the picture, it doesn't look very pretty, but it's not caused by flies and it's essentially harmless. A fly mask won't help because it's not caused by the flies. However, it will provide a protective barrier between the eye and whatever they might scratch it against, since their eyes will also get itchy. Additionally, it's important to watch your horse if they're having these symptoms because they can go into distress. This is when respiration rate gets very high, the breathing will be very labored, they could be lethargic, have a fever, or be sweating. And if you see any of these symptoms, it's important that you have your vet out right away so that they can give an intravenous steroid to help immediately. There are many treatment options available, but not any cures. Especially if your horse is having asthma long term, changing the environment can be really helpful. So if your horse is stalled inside, use a low dust bedding, and you can even wet the shavings down after you put new shavings in. This helps just reduce the dust, and also don't let your horse be in the stall with you while you're changing the bedding, because as you're removing the manure, it will be stirring dust up the building breathing. No matter where your horse lives, it's really important to get your horse off of round bills. All hay will have mold, but round bills have higher concentrations of it because of how they're baled, stored, and their large size. So no matter what hay you feed, using a hay net is really helpful. It helps them to not be able to stick their entire nose into the hay and be breathing dust particles as they're moving. For most cases, environmental treatment will not be sufficient to take care of the symptoms, so there are some medicines that are options for your horse. The most common one is dexamethasone. It is a corticosteroid that helps reduce inflammation. It does come with a potential side effect of causing laminitis in your horse. This is really serious, especially if your horse is prone to laminitis already or has metabolic issues. Another steroid that could be an option if Dex isn't is prednisolone. It's like prednisone for humans, except horses are not able to break down prednisone, so it's a different form of the same drug for your horse. And there are minimal side effects with that. Another option, if your horse's asthma is caused by certain allergens, is cetirizine, which is the active ingredient in Zyrtec. And so you can perform a bronchoalveolar lavage test at your vet clinic to see if this is an option for you. Some other treatment include supplements. Supplements there's many of them out on the market, and they all have varied effectivity. And it just depends on your horse, so it's a lot of trial and error with that. One thing that can really help is flax oil. It has a high concentration of omega-3s, which are shown to reduce inflammation throughout the entire body, including the respiratory system. And it will also make your horse's coat shiny, so it's an added bonus with that. There's also a nebulizer mask that you can get for your horse. It's like an inhaler for humans, except it straps onto their nose, and the downside of this is it's quite expensive. It's about $1,500 just for the mask, and that doesn't even include the medicines. So it might not be economical for most people, but in some cases it is very effective. There's also the option of getting pelleted hay. And pelleted hay is also another very expensive option, but it does significantly cut down on the dust that is with hay. And it does require extra time in your barn chore routine, as you have to soak it before each feeding. Another option that's a little more reasonable is that you can wet your hay down, just your normal hay, and that will help lower the dust as they're eating it. It does add extra time again because you have to prepare it for each serving so that mold does not develop. Despite all the challenges that come with caring for and treating an asthmatic horse, it's definitely worth the extra effort, as they are still able to live happy lives and show off their unique personalities. It doesn't mean there won't be ups and downs, but it takes more than asthma to separate the bond between a horse and their human. Thank you.